Hey friends, my name is Calyx. I'm not your average NB and welcome back to my channel. I changed my name while I was on break. Well, I didn't change it. I already had it. It was legally changed. Calyx is my middle name, so I'm going by that now. I made it my middle name to in case I ever wanted to go by it. Uh, um okay. So I'm gonna do a Reddit video right now. I was gonna wait till August, but my mom's out to dinner, so I don't know how much time I have. I'm gonna have to stop the video when she says she's on her way home, but she always texts me, so I'll just stop the video when she texts me. So hopefully I can get some video done before then. But I wanted to start with this one that just popped up on my homepage. Ugh, okay. Uh, sorry. Anyway. Um, I wanted to, this one is from r slash am I the butt face, which is another similar one to r slash am I the asshole. Am I the butt face for telling my husband to clean up after himself? And then there's a text conversation. There's a picture of the toilet with a star covering what I'm assuming is some poop stain, is some poop from where you pooped. Like, it's not a poop, but after you flush the toilet, you have that little bit of poop residue sometimes. Anyway, why do you do this and not clean? Because I don't realize. Please always check baby because I'm tired of cleaning the toilet before I go. And then he just says K. And it's gross. Why you say K? Are you upset that I said something? I'm upset at the way you said it. I was just asking why you do it, and then I said politely to please check. Okay. Okay, I love you. I'm not trying to be mean. Yes, you were. I really wasn't. It gets misinterpreted over text, remember? For you trying to be mean, you couldn't have been more of an asshole. Wow, okay. It's funny you say I'm the asshole because it's literally your asshole making all this mess. Okay, so my husband has been leaving shit stains in the toilet. I finally got tired of it and told him I wasn't trying to be mean when I texted him, but he says I'm being a butt face. Am I the butt face? That's literally, I'm not trying to change the word asshole for anything. That's literally the word. That's what it's called. Am I the butt face? There's like 100 of these am I the asshole type subreddits, so I just love visiting these. And then the comments, how do girls deal with dudes that just shit on the toilet and not even wipe their ass? As a guy in my 30s, I find that disgusting. Would definitely be a deal breaker. And then someone else says, I do believe I'd start leaving blood on the rim. That's diabolical. I love you. The snottiness is there because it seems like OP has repeatedly asked and nicely. At this point, I match energy. I would start nicely. Just like OP did, but damn. OP confirmed in another comment this isn't the first time, and he's gone as far as ignoring a shit stain for like a month. Probably the strongest willed woman on earth, because I would use this toothbrush to clean it up. That seems like a war crime. But still, I get the point they're trying to make. Ask him how you wanted him to tell this to tell him Ask him how he wanted you to tell him this in a way that would make him do it that you haven't tried yet, because it sounds like you've been over this multiple times and he hasn't changed anything. Thank you. I tend to talk to my mom about stuff like a lot, and it still seems to happen. So I'm like, okay, tell me how to. So I'm like, okay, tell me. Can you tell me how to tell you this in a way that you'll actually listen and do something about it, and it will actually cause you to change your behavior? And then she says, I don't know. And I'm like, okay, so could you please think about it? And then she says, yes, I will think about it. And then it like never comes into play again until, the next time I have to say something. Shit, my mom is home. I'm gonna have to do the rest of this tomorrow. Hey guys, mom's out again, so I'm gonna try and record some more stuff. And the first story we have is from r slash am I the asshole? Am I the asshole for telling my mentally unwell friend about his dog that passed in my hands? And this one is marked as not the asshole. I am a 23-year-old female and I have a friend, 28 male, that had an extremely old underweight dog, and he asked me if I could take care of it for a week, or he went to his home country in Belgium. He was depressed, which is crossed out with stars, so I really wanted to help him, so I agreed even though I'm struggling financially to even take care of myself. Um, at first, I realized the dog wasn't eating, so I texted him asking if this was normal. He told me he was, and he already went to the vet. He also said that the dog would be eating the next day, so I shouldn't worry. The next day passed, and he still wasn't eating. I tried feeding him with the syringe, as he was barely any teeth, and it worked to an extent. He would only eat a certain amount of wet food, or he would just not swallow the rest. For the third days, noticed that he was sleeping the whole day, and I worried. I knew this wasn't a good sign, so I texted him again. He again said it was normal. The next day, the dog wouldn't wake up. I was devastated. I was having a panic attack, not knowing what to do. My friend was already struggling with mental health, so I was scared of what this news could do to him, especially on vacation. I decided that I needed to tell him. That's the only thing I could legally do, anyways, so I told him. I told him everything. He left me on scene. Next thing I know, his mother, who lived next door, was at my door to help discard the dog and confirm the passing. She said it wasn't my fault and that the dog was old and struggling, but he just didn't want to let his childhood pet go, even if he was told to put him down. I'm going to see him in a few days, and I know he's going to be furious. I feel like this was my fault for not taking him to the vet, and I could have potentially prevented this. You couldn't have prevented this, even if you had taken the dog to the vet. Like, there's no way. Animals die. That's just the reality of the situation. That's just the reality of the situation. Um, anyway, so let's check out some of the comments. You don't know that he's going to be furious, and really, if he is, it's just misplaced grief and blame which he needs kicking to the curb for, because it sounds like the dog was going to pass away soon, and your friend couldn't bear to watch, so left him with you. This was a cowardly asshole thing to do to you. You did the best you could to make the pup comfortable, not the asshole. Not the asshole. His mother lived next door but couldn't watch the dog. If my dog was so old and sick, I couldn't imagine taking a trip out of the country. It was clear that the dog was knocking on death's door. Even his mother said that it was recommended that the dog be put down. The dog's passing was not your fault. He stopped eating, whether from loneliness because his owner was away or illness. That shows that the dog didn't want to go on. And then OP responds and says he has an on and off relationship with his mother, and he has been struggling with mental health for a while and recently had a huge argument with his mom, so I didn't want to give the dog to her. Not the asshole. Your friend left you in charge because he knew the dog was going to die and didn't want to deal with it. If anyone should be furious here, it's you. He did this intentionally to you. And frankly, I'd have a hard time forgiving him for it. I also deal with depression and would never leave my beloved pet knowing he was about to die. Your friend better ask you forgiveness for this, and you better not take any of the blame because you did all you could. There's no way you could have kept an old dog alive when even the vet said it was time to let him go. Thanks, you're right. And then OP says, thanks, you're right. I just thought that if I brought him to the vet, maybe they could do something. I'm not experienced with pets, but I do know that if the vet's saying that it's their time to go, then it's their time to go. That dog was beyond help. At most, the vet could have maybe kept the poor thing alive for another day or two and just extended its suffering. Your friend was a major asshole for leaving you with a dying dog and refusing to understand. It probably should have been put down before it got to this point. If he blames you at all, he's no friend. He was a major asshole to both the dog and OP. OP got traumatized by a death they weren't expecting to happen and weren't prepared for. The dog died in the house of a stranger and quite possibly in unnecessary pain because the owner was hiding from the reality of his imminent death. But also, OP, thank you for caring and trying so hard on behalf of that dog. You trusted your friend and did all of the right things within that framework of trusting the information you were given. Yes, he left his companion animal to suffer with a stranger and told it off to enjoy his vacation. He's a peach. OP is not the asshole, but that friendship should be over. He said he already took the dog to the vet. When my old dog stopped eating and seemed really off, we took her to the vet, and he essentially said we can run some tests, but it's unlikely she'll be around when we get the results back. It's time to make the hard decision. It's likely he got a similar speech and decided to not make the hard decision and just bail. All the vet would have done was offer to euthanize at your expense or take him home and let him pass. They wouldn't have been able to do any more. Don't let your friend blame you for what happened. You did all you could. Perhaps the dog waited until your friend wasn't there, knowing he would have wanted him to carry on, but the dog needed to let go. You loved him and cared for him until it was time to cross the rainbow bridge. That's all anyone can do. And given your friend knew his dog was in decline, many could argue he shouldn't have left him. Don't let him blame you. He's allowed to be upset or angry at the situation. He's not allowed to be angry or upset at you. The above comment rings so true. I was letting a neighbor pasture some horses at my place, and then they wanted me to start paying farrier fees and warming costs, which we shot down pretty quickly. And then I overheard them talking about how they hoped one older horse would die at our place, so they wouldn't have to deal with it. And I was like, "Come get your horses now." OP, you did good taking care of the poor old pupper in his last days. Once they're done eating, they're getting pretty much done most of the time. I agree. The mom's comment suggests that the owner was already told the dog was dying before going on vacation. The fact they did not tell OP that is absolutely inexcusable. If I were you, OP, I'd be absolutely furious with your friend and reconsidering that relationship. The friend knew what was happening and, through denial or cruelty, refused to intervene and make the dog's passing more humane, and made OP suffer through all that worry and pain. I'm not sure that's a friend I'd want. You would have been the asshole if you took the dog to the vet and the vet put him down right there. You were the kind and compassionate to this dog. Your friend may not want to face the grief and may be distant because of it, not because it's your fault, but because the dog sadly passed. I would also want to know right away, so I think you telling them was kind. If you kept it to yourself and they came back, they would have asked why you didn't tell them, and also you may have sent the dog off in a way that they may not want. Even though this dog wasn't yours, I am sorry for your loss, OP, and that you had to be in this situation. Why does this have -3 downvotes? Respectfully disagree that OP would have been the asshole for having a vet help the dog to sleep. Doing so may have had unfortunate legal consequences, depending on jurisdiction and the friend's reaction, but from a moral standpoint, sending an animal in your care off with dignity and love when they are clearly declining and ready to go is pretty much the best thing to do. Fortunately, it didn't sound like the dog suffered too much passing without vet assistance, but that's not always the way it goes. Downvoting you, it would never be an asshole thing to let a vet stop a dog from suffering. This guy was such an asshole to not take care of his dog. The dog deserved way better than his owner. Uh, the stages you described, the dog was dying, and there was absolutely nothing you could have done to change that. Going to the vet would not have changed the end result. Question: his mother lives next door, then why did he ask you to watch the dog and not his mother? And then OP says his mother is one of the reasons he's depressed. He didn't want to give it to her because he didn't trust her. And, well, it sounds like mom was right about the dog. Also, people don't cause us to be depressed. Their actions can be hurtful, but if we are adults, we get to decide how much we let them affect our lives. Thank you for giving me even more self blame. Dealing with depression is bad enough. Telling people that essentially themselves are the reason they're depressed because if we are adults, we get to decide how much we let them affect our lives is not okay. Yeah, that's not how depression works. Depression isn't a choice, and there can be many reasons why someone is depressed, and the outside factors, like, no one's saying they're making you depressed, but, like, I mean, yeah, it, I would, if you're like, depression is super complicated, and it's not how depression works at all. Anyway, um, is not okay. What are you even talking about? You said his mother was causing his depression. What's that have to do with you? If someone is causing us harm, it's not on them to change who they are. It's on us to protect ourselves from further harm. As someone who has struggled with depression my entire life, I can tell you that no other person causes depression. Situations can amplify it, can trigger it, can compound the negative effects, but it doesn't cause it. Was I depressed for years with my previous partner? Yes, I was, and my depression lifted when I was no longer with that partner. But that partner didn't cause my depression. The cause of my depression was inside me. Okay. Ugh. A lot of advice given to OPs from these kinds of stories is taken up by people in similar but not exactly the same situations. Giving advice like this when people are in the deep end of the pool drowning is not constructive. Leave that to a therapist who will keep talking about the whys and wherefores, who can keep an eye on the depressed person so they don't go drowning even faster. Probably because she would have done the right thing by the dog that he didn't want to do, and that's in response to someone asking why he wouldn't let the mom take care of the dog. And that's probably true, that she probably would have taken him to the vet and had him euthanized, which is pretty fucked up to not have your dog euthanized when you know they're suffering and they're dying. Not the asshole, and this may have been his plan. He couldn't do it himself. I've been given the task before without warning. It sucks, but do not blame yourself for this. The dog wasn't going to live. They have a short lifespan. It's the worst part about loving a dog, but it is what it is. Do not accept his anger if it's directed at you. When I was a teen, my boyfriend's family couldn't cope with their family dog being put to sleep, so I had to hold him while they all sobbed or left the room. I don't hold it against them at all because, as you say, some people can't handle it themselves. He left his dying dog with you. You are not the asshole, but he clearly is an asshole. Who does something like that? That's disgusting. The dog had to die alone and without family, and you had to handle the death of the dog. Selfish prick. Agree 100%. Not the asshole, you did good. Everything you asked him told you that you were doing the right thing at the time, and the dog was acting normal so far as what the owner said. I think your friend had taken him to the vet, and the vet had told him to put the dog down, and he didn't have the heart to do it, and he knew he was very close to the end, and left it to you. You are not the asshole, but he is. He is a prick. Alright. I'm gonna go into my posts and find a new, I'm gonna go to my saved posts and find something else to read. This next one is from r/morbid questions. Now, what's the one time you thought you were really going to die? Okay, so I'll share my story first. This happened earlier this year, I think in January or February, like really, really early in the year. Um, and I was having some kind of like anxiety attack, and my heart was beating really fast, a- and like basically I was having a crazy anxiety attack, and then I was looking for my pulse, but I couldn't feel my pulse was extremely faint, and I couldn't find a pulse. So I freaked out, and I woke up my mom, and I did all that, and then and I was looking online, and if you can't find a pulse, it says maybe you had some heart problems, like a heart attack or whatever. So, like, I ended up just like I ended up waking up my mom and getting her to check for my pulse, and she could feel it, but very faintly. So, all the stuff I was reading online about a very faint pulse was freaking me out. Um, so I ended up calling the hospital who sent an ambulance, and they had a couple of people like check me out where they came to the house, and they checked my like pulse and blood pressure and everything, and they said everything was good, and I just had a very faint pulse um for whatever reason. And then I just had an anxiety attack, and then I was just freaked out. So that was that. Let's read some of these I told this story a few times here, but I got hit head on by a camper van while on my moped. If I hadn't been wearing as much gear as I was, I would have died. Thankfully, I survived, but my lower left leg was mangled beyond repair and had to be amputated below the knee. Ugh. I was a stupid teen walking on the railroads because it felt cool. It is the busiest railroad in my country. Of course, a train came. My girlfriend jumped off the tracks, and I was just standing there frozen. If she didn't shout my name and got me out of the shock, I would have died. Never again did anything that level of stupidity. When I was 10 years old, my father, myself, and my brother were going to Grandma's for the weekend. I was watching the first Garfield movie in the back of his soft top Mini Cooper. Out of nowhere, I felt the car get hit on the passenger side, which was occupied by my brother and my upper half in the back seat. I felt the car thrash around, but my father managed to regain control of the vehicle. I had never felt such fear for my life as I did in those seconds. My dad had fallen asleep at the wheel and struck a semi at 75 miles per hour due to undiagnosed obstructive sleep apnea. Uh, all three of us sustained minimal trauma. My dad had a few tiny cuts. My brother had a mild seatbelt rash on his neck, and I had a few tiny cuts. We were totally fine. The car was badly mangled, and the police and semi driver said that we should be dead. My mom having a breakdown and going fucking berserk. I tried to stop her from hitting herself, so she bit down on my hands and started beating the air around me. She grabbed me with such violence, I thought she was going to kill me. Two times for me. First time I had appendicitis, which was wrongly diagnosed as a stomach flu. I went back to the ER 3 days later, at which point my appendix had already ruptured. They took it out, and at first I seemed to be recovering well. Then I started getting really sick. High fever, low blood pressure, barely able to keep my eyes open. Turns out I had sepsis and needed another surgery to wash me out. A few minutes before they took me in, everything stopped hurting, and I felt a peace I've never felt before or since. I was so tired and realized it was time to just let go and see my dad again, who passed away a long time ago. Then I thought about my mom and all the things I hadn't done and told myself to hold on as long as I could. Next thing I knew, I was waking up with a 10-inch scar on my belly and some permanent nerve damage. I genuinely believe that had the second surgery been delayed by a few minutes, I wouldn't be here. The second time was worse. One day I woke up and my jaw was a bit swollen. I had a bunch of dental issues, broken teeth, cavities, etc., and didn't have the money to fix it. My teeth would hurt for a while and stop, so I figured it was just the normal pain. Within 12 hours or so, my jaw swelled more and more. My lips, my neck, even the palate under my tongue was swelling so badly that I couldn't talk properly or swallow. I called an ambulance in the middle of the night and told them I thought maybe it was just a panic attack. The paramedics told me it was bad and that it wasn't a panic attack. The ER started me on antibiotics and steroids, hoping they could stop the swelling, but it continued to get worse. They ultimately had to intubate, and I nearly avoided a tracheostomy, which, if I remember correctly, is the thing where they have to cut a hole in your throat and stick a tube in there so you can breathe properly. I was intubated for 5 days, hospitalized for 16 days, ended up with ICU delirium, which led to another hospitalization, and somehow made it to the other side. I had something called angina, and I was very lucky that the infection hadn't moved on to my brain. If I'd waited a little longer to call an ambulance, I wouldn't be here. If I had just laid down and gone to sleep, my family would have found me dead in the morning. That time I didn't feel any peace or desire to let go. I was just terrified. All I could think as I waited for the steroids to work, hoping that I wouldn't have to be intubated, was how useless my life had been, how many opportunities I'd wasted, and that the next breath I took could be my last. I thought about how alone I was, and that I was alone because of my own choices and hubris and emotions. A day or two before, I'd been thinking of suicide, and all of a sudden, I desperately wanted another chance to live. I prayed to my Father, God, the universe, anyone and anything to just let me make it through the other side. I don't know why I'm still here, but I am, and I don't take it for granted anymore. I made a lot of changes since then, and I'm a better person than I was. I'm so grateful to the doctors and nurses who didn't give up on me, made me better, and gave me a third chance that I probably didn't deserve. I'm so thankful that wasn't my end. Glad you're here. Alright. Um, go find another post. This next one's from r/wedding shaming. My older half sister who doesn't invite me to her child-free wedding as I am 19 expects a gift. What? 19? Okay. And then there's a text conversation and it starts out view our wedding registry and then a link to Amazon. Is this your wedding registry? What else could it possibly be? Why are you sending it to me? A bunch of question marks. You're my sister. I'm not invited though. Can't make it does not I'm not invited though. It's super common for people who cannot make it to get a small gift. Can't make it does not equal not invited. It's a child-free wedding. I'm a fully grown adult. You're under 21. You're having a dry wedding. Why does that matter? We've been over this. That was before a gift was requested. I'm an adult. It's my wedding and you're a teenager. It's clear by your reaction to my decisions regarding my own wedding that you are not mature enough to attend adult events or exist in adult spaces. Wow. It's my money, not getting a gift, and begging for expensive crap from a broke college student is cringe as hell. You being immature and unsupportive, and then they send a text that just says fart noises. My point stands. Holy crap. Alright. She is beyond delusional. Children don't bring gifts, though. Their parents do, right? So by her own logic, you are not supposed to. Insanity. That's my thoughts, too. If you're too young to attend the wedding, you're too young to buy a gift. Draw a picture with some crayons and call it a day. Several pieces of dry macaroni on a scratchy-ass string. Noodle art would be hilarious, especially since she would definitely tell people about it, trying to make OP look petty and childish, and then that would 100% backfire on her with everyone she told. You expected a gift from a child? Me as a wedding guest. Oh my gosh. I love that. Alright, that was just a really short and fun one. Hmm. Oh. Hmm. Alright, this next one's longer because it's from Best of Reddit or Updates, one of my favorite subreddits. It might actually be my favorite subreddit. Anyway, Best of Reddit or updates. I told the doctor my mom was lying about my symptoms. And the trigger warnings are abuse, Munchausen syndrome by proxy, eating disorder. Okay. Um, and then original post. Oh, definition from Cleveland Clinic of Munchausen. Factitious disorder imposed on another, formerly called Munchausen syndrome by proxy, is a mental health condition where you pretend that someone within your care is sick when they aren't. It's a type of abuse. Original post, June 24th, 2025. Title: I know my mom is over exaggerating my symptoms, but I don't know what to do. Hey doctors, I made a Reddit account after for this question after I did a Google search. It seemed like the safest way to get an answer privately. I'm a 15-year-old girl. I'm 5 foot and 82 pounds. I take Keppra, hydroxychloroquine, and Adderall. I live in the US. This has been going on for 5 years. So since you were 10? Wow, okay. Um, I'm diagnosed with epilepsy, undifferentiated connective tissue disorder, and ADHD. My mom thinks I have POTS, EDS, and some other things. Basically, I had a seizure once when I was about 10 on a school field trip. My mom had always been really intense anytime I got sick. She took me to the doctor for every single cold. But this seizure sent her overboard, and since then she's basically been convinced that I have some kind of serious diseases. At first, I believed her. She was good at convincing me I was feeling things or that stuff happened that I didn't remember because I was having a seizure. But the only one I know I had for sure was the one in fifth grade, and when I was at the hospital after, they didn't find an obvious cause. Since then, my mom takes me to all these appointments claiming I have symptoms I don't, or making them sound way worse than they are. For example, she'll claim I'm having fevers and that the only reason I don't have one in clinic is because I took Tylenol. It'll be true that I took Tylenol, but not because I had a fever. She just gives it to me. She'll always have me take cold medicine before cardiology appointments. Like she says, "Here, you're sniffly, take this." But now I'm reading that cold medicine makes your heart rate go up, and half the time I don't even feel sniffly. It's like she'll plant things too. She'll start saying you seem lightheaded, your joints look swollen, you look out of focus, like she's trying to convince me. And it used to work, but now I'm sitting here like I feel fine, and I'm sick of all these appointments. I want to do stuff with my friends and stop taking meds that make me bitchy and sad and sick to my stomach. She'll take pictures at angles that make things look worse than they are. One time I got a ton of bruises after playing on a water slide inflatable thing and taking a bunch of ibuprofen for joint pain, but I got a ton of bruises from it and she told the doctor they showed up with no cause and I got a full leukemia workup and she was telling everyone how I probably had leukemia. I didn't. I knew what it was from, but she convinced me that playing on inflatables would never cause that kind of bruising unless I was really sick, so I didn't say anything. The problem is now it's been years, and I'm afraid if I say something, we're going to get in trouble. And no doctor will ever believe me if I do get sick someday. I don't know why I didn't say something sooner. I've been pretty sure for like 2 years that she's making most of this up, but it's confusing, and I don't know. I thought maybe she was right, and I was just brushing off things. Sometimes it would feel like she was right. What do I do? Can I tell the doctors I see that it's probably not real, or is this going to ruin my medical care forever? Also, I really did have a seizure when I was 10. I was at school and there was a whole cafeteria of witnesses, so that wasn't made up. I don't even know what's real at this point, though. I had a high ANA, 1 to 160, but I don't think a lot of the other symptoms that got the connective tissue disease diagnosis were real. I'm not trying to say it's not my fault, too. I should have said something sooner, but I feel stuck. No, you're a child. Um, Please help me figure this out. I see a cardiologist Thursday and I want this to be over. Also, I know my BMI is low. I don't eat a lot. I'm working on it. Some of OOP's comments to a comment explaining Munchausen by proxy syndrome and seeing if OOP can go to the doctor by herself. OOP, I would probably could go to a doctor myself, but my mom won't let me because she says it's important to have an adult who can explain things and that she wants to make sure she knows the treatment plan. I also don't go back to school until September. Is there some way to signal to a doctor to ask me something alone, or go make my mom sign papers or something? And then the commenter replies, if it's possible and you can sneak away for a few minutes, you can call the doctor's office and let them know in advance that you need to speak to the doctor privately without your mother present. If it's not possible for you to sneak away and make the call, I would write a small, easily hidden note before you go and keep it in your pocket. After you're in the exam room, say that you need to use the bathroom. Hand the note to literally anybody staff wise that you encounter. Make it a point to see someone on the staff. Even if you know where the restroom is, go ask them where it is as an excuse to pass the note. You can say something simple like, please let the doctor know I need to talk to them alone and it's urgent, but I don't want my mom to be suspicious. OOP, thank you. After I do that, what happens? Will they just tell my mom they didn't find anything and I can be done, or are we gonna get in trouble? Is it gonna make it hard if I have an issue in the future? Uh, someone else. And then the commenter replies again. I can only speak as a physician in the United States. I'm not sure if you're based in the USA, but here, once you explain what's going on to your physician is required by law to report the abuse. And make no mistake, based on what you've told us here, you're being abused. An investigation will be opened, and you'll have a chance to tell investigators everything. The only one who's going to get in any trouble is your mother. You were a child. You were doing what your mother tells you to do, and everybody involved in the investigation will know that. You don't need to be worried about future visits. You'll be taken seriously. Your mother needs a mental health professional. She has a mental illness, and it's one that can quite literally put your life in danger. Life might absolutely suck for your family for a little while, but if your mom doesn't get better, she's going to make you get worse. Reaching out to your physician on Thursday is the first step in ensuring that your mother gets the help that she needs. OOP, I'm in the USA. Does opening an investigation always mean that I won't live with my mom anymore, or just she'll get therapy and help? Also, I think my doctors think my weight is from the illness they think I have, but it's not. I'm not really eating a lot, like on purpose, and I kind of want to mention it, but is this the right time, or should I just do one thing at a time? I know I need to have more and I'm trying, but it's not going all that well. And unfortunately, there's no response to that one. But a response to a comment calling it abuse. Abuse just feels like blowing it out of proportion. I know what you mean, and I know it's not right. It just feels like then I'm exaggerating. She's not hurting me, just pretending I'm hurt. Okay, hurting just because she's not hurting you. That's not the only kind of abuse, by the way. Like, just because someone isn't hitting you doesn't mean they're not abusing you. Commenter, not a doctor. She doesn't want to hurt you. She almost certainly genuinely thinks she's helping, but she has a mental illness, as the doctor above said. You need to put your health first, and since you sound concerned about her, you can support her as she gets help, and you don't have to stop loving or caring about her. OOP, that makes me feel better too. I don't want to see her as some kind of bad guy. I just don't want to keep getting blood draws and lying to doctors. And then on eating less, I'm not trying to make myself feel sick by eating less. I'm not really sure why. I just like having something else that's mine and she doesn't have any say in, I think. Like I get to choose this one thing if that makes sense, which is actually the reason why a lot of people develop eating disorders for control and stuff, by my understanding anyway. To a comment with some resources. I'll look at the resources. I think they think my weight is from something else. My mom has been saying I'm having bathroom issues, and I guess I kind of am, but I think it's because of how I'm eating, not the other way around. But it's getting hard to change how I eat even when I want to now. Like with my friends, I can't relax those rules at all. Comment, not a doctor. Commenter, not a doctor, but a pharmacist. She is hurting you. You're currently taking hydroxychloroquine chloroquine, which builds up over time in your eyes and causes blindness. Oh shit. We still use it in patients with serious diseases like lupus, MCDT, and UCDT because those diseases are so severe and the risk of blindness is outweighed by the risk of organ damage, joint destruction, and death if you don't treat them. Typically, we start this medication in patients who are much older than you as well to reduce how long the patient is exposed to the medicine. You are very young, and taking this medication over time could cause serious and irreversible changes to your vision. I'm not saying this to scare you or anyone else out of taking a necessary medication, but it sounds like in your case there's a very good chance it's not necessary. At the very least, you deserve to know if you really have UCTD or not. If the if the severity of your UCTD is to the point that you need to be on HCQ or not, and if the dose you're on is appropriate for your symptom level. You also deserve to not be blind in your 20s or 30s due to unnecessary medication use. OP. OOP. I didn't know it could cause blindness. I know I started getting my eyes checked every year, but I thought it was because the disease could affect them. OOP adds, I know my mom watches my phone records like who I call and text, so I'm not sure calling ahead is a good idea, but I think I'm going to write a note. And then OOP adds some thoughts in a comment. Same day, 9 hours later. Here's something else I've been thinking about since I posted. So I looked up some of the eating issue treatment stuff, and it looks like the main kind of therapy is family based therapy, where your parents have to take over your whole diet. And that sounds horrible to me. First of all, I think my mom would maybe like it if I had a problem, and especially if it meant she got to be in charge of everything I eat and do. And that sounds like a nightmare to me, and I'm thinking maybe it's better not to say anything and wait until I'm an adult and can deal with it alone. And then on OOP's dad, it's just me and my mom. My dad died when I was too little to remember. Do you think I can ask to go somewhere else to get better if it's too hard to do it on my own? I really don't want to involved. And then to a longer advice comment. I get what you were saying. Thank you. I do actually like the cardiologist. He's nice and he has a good sense of humor and actually talks to me and not just my mom. So I feel like he's a good person to start with. I just kind of panic seeing family based therapy. Okay. Update post July 18th, 2025. 3 weeks later. Okay. I posted here once before because I knew my mom was lying about me being sicker than I was, and I wasn't sure how to handle it. I took everyone's advice and ended up telling them at the next appointment. After we checked in, I said I had to go to the bathroom and I left a note with a nurse. I think my doctor maybe looked at it before the appointment actually, because it took a really long time for us to go back. And then the appointment, the doctor was asking a lot more probing questions and clarifying questions and pointing out inconsistencies my mom said. And then he asked to talk to me by myself and my mom by herself too, actually. So I'm seeing a team of doctors now who wanted to verify some of the diagnoses that I had. Yeah. And they admitted me to do that. Like in the hospital, and there was always a nurse or someone in my room with me. I'm not 100% sure because no one actually told me this is why, but I'm guessing it was to make sure my mom didn't say or do anything or give me anything. Is that something they'd actually do? It sounds so dramatic. Or maybe it's normal to check things out in the hospital like that. I don't know. Um, anyway, they're changing some of my diagnoses now, and my mom is talking with a counselor. She still maintains that she's not doing anything to me, and I'm really sick and just getting influenced by crime documentaries, adding she caught me listening to the podcast for context. But things are a little better. She's not supposed to be in charge of any of my meds now. I do that myself. And I write down everything I take and went in a journal so there's a record, and I'm not taking the high HD HCQ or whatever, however the short form is. Thank you guys for telling me to say something. I was really afraid I was going to get in trouble, but no one was mad. Not even at my mom, actually. They were nice about it. Maybe a little stern, but nice. Editor's note. Wasn't sure whether to mark this as concluded or ongoing. It is concluded in the sense that OOP's initial question about how and whether or not to talk to her doctor was answered, but obviously we would still love to get more information. Nightmare fuel, but I'm really impressed by her care team stepping in and getting both the mother and daughter the help they needed in a non confrontational way. The thing about not wanting to see her mom as bad is so heartbreaking. Addressing things in a non confrontational way is helping the daughter want to work with them and be honest, and keeping the mother from escalating, but holy shit, when she's an adult, she may come to feel differently, and possibly even resent the adults for not standing up for her more. The paradox is if they tried that, she wouldn't be as cooperative and would be more traumatized. I feel for professionals who are in this situation. And what a great use of Reddit. If she spoke to any of the other adults in her life, there's a high chance they would be tainted by what the mom had already laid down. It also sucks that because this is a prime example of how behavior doesn't have to be malicious or even intentional to be abusive. Like, your mom thinks on some level that she's helping you and your mom's abusing you are both completely true here. And unfortunately, the mom's intentions are totally irrelevant when her actions are tangibly harming her daughter. It's like I like to say that intentions are important, but they aren't magic. If your foot gets stood on and you wind up with a broken bone, it's nice to know that the person who did it had an accident and tripped rather than maliciously decided to stamp on your foot. But it doesn't change the fact that your bone is broken. You can forgive them for the situation a lot easier, but either way, you still need the same time and medical care to recover. We judge ourselves on our intentions, we judge others on their actions. I feel like her feelings may change when she realizes her mom was also inadvertently causing her eating disorder. Most eating disorders come from a place of lack of control. Okay, I was right. The person feels they have no control over anything except what they eat. Then it spirals destructively. I hope OOP recovers from that as she gains control over her meds now. I'm shocked the doctors let her have Adderall while under 100 pounds. I hope they decide to decrease her dose at least. It wouldn't fix the control issues, but it would help her to want food. The kids I know on stimulants have to eat breakfast before the med, or they won't be able to stomach it. For sure, they're nice to mom to keep her from going apeshit as well as keeping OOP compliant and guilt-free. But behind the scenes, they're most likely finding placement out of reach of the mother because she's liable to poison the poor child. 100% mother knew about the blindness risk and was completely cool with it. Yeah, they would never give him medication with that without explaining the risks. She'd have full control of a blind child, and imagine the glorious pity she'd be receiving for caring for a blind, frail adult daughter. OP will definitely be sick to her stomach one day about what was done to her. Now she's got the backbone to fight it. Once she fully understands that her mother did it on purpose for a perverted need, she'll see how messed up this whole thing was. It's easy to feel bad about getting a doting mother in trouble, but the mother could slowly kill her and relish all the compassion and pity for the rest of her life. But behind the scenes, they're most likely finding placement out of reach of the mother because she's liable to poison the poor child. I don't necessarily think this is the case. OP said they are responsible for their own meds now and clearly have more of a voice with the doctors. If they were a small child, yeah, every would probably need to place them with someone who was more safe, but they were a teen. The professionals, both the doctors and social workers, will be on the lookout for any further abuse and will look at any new medical issues from this lens. 100% mother knew about the blindness risk and was completely cool with it. I wouldn't be so certain. My wife actually has most of the conditions OOP mentioned. I go with her to every doctor appointment and fill all of her prescriptions. She was on that one medicine that I can't HCQ or whatever. Uh, for a time, and I was unaware of this risk. It was one of the "we are throwing darts at the dartboard, let's see if we hit anything" approaches. I do remember she had to do a lot of blood work before and during. Presumably, OOP would as well. It was prescribed. It's not like her mother was sneaking it to her. Side note, that was one of the drugs that the crazies latched onto during COVID. It had massive shortages. My wife's doctor discontinued it for her in February 2020. We just barely missed the absolute headache that would have been. Okay. People with Munchausen's and Munchausen by proxy spend a lot of time researching illnesses, their symptoms, and the medications that are used to treat the illness. The fact she was giving her daughter cough medicine before going to the doctor so her heart rate speeds up shows that she is quite devious, and this is typical of people with Munchausen by proxy. She's willing to risk her doctor at minimum needing medication that affects her heart rate, when in reality her heart is absolutely fine. So having a blind daughter would be a dream for someone like her mother. These people will do things like doctor shopping, finding hospitals that do not use the same system for logging visits and prescriptions, so they can continue to get prescribed medications that the child doesn't need. They don't do things by chance. It's all planned to get to keep getting the attention they want and to keep their child sickly and fragile. I've seen people with Munchausen's pick holes in their legs where you can see through their leg because they had picked all the meat off, which required amputation. There's people who infect their pick lines with actual feces. They will try to cause themselves to get sepsis, etc. They are not well and are not in the same sphere as someone like your wife who has a genuine illness and wants to get better. People with Munchausen are the opposite of that. Yeah, if it is true that this is Munchausen by proxy, the person who said your mom believes she is helping you is wrong. It's a compulsive disorder. The mom isn't thinking about what's best for the daughter at all. She's trying to get a of the specific type of attention or feelings she gets from having a sick child. It's not the same as parents who are anxious and truly believe their child is sick. Health anxiety by proxy is a thing too, where a parent actually believes a kid is sick. Alright. Yeah, it's a totally different thing, I feel like. Alright. She's controlling her food intake because that's the only control she had in her life. Pretty typical eating disorder behavior. I hope she gets all the help she needs and can break away from the codependent mother. That's how my friend developed anorexia. Super busy at college with classes, clubs, sports, friends, and relationships, and the one thing she felt she had power over was food. Alright, so this is kind of a shorter one. I'm gonna end it everyone. You guys forget to be good to yourself and to others, and I will see all you guys in the next video, which will be in August at some time.